Hey there VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video, we're going to look at answering the 2019 VCE HHD exam, question number 7. Before we dive in and look at question number 7, just a reminder over at the Health Resources Hub YouTube channel, a new video like this one is coming out each day between now and the HHD exam at the end of this year. You can subscribe with the button in the bottom corner of the video here. Please let your other HHD friends know to do so too. I'm running the ACE HHD exam preparation sessions this year, and so you can book a spot to those at book.acevce.com. They're coming up in the September break. You can see our social media links there if you'd like to follow us and get alerts to the new videos coming out each day, and also our email if you've got any questions or any suggestions on videos you'd like me to work on. You can see here question 7 from the 2019 exam was worth 5 marks, and it started with some information here in the stimulus material about World Antibiotics Awareness Week, and talked about how the WHO, was starting to develop a global action plan to tackle the growing problem of resistance to antibiotics and other antimicrobial medicines. And so they mentioned here in the infographic that laboratories worldwide were taking action to track the spread of drug resistance. And you can see the WHO logo up there, And so the first question here, A for 3 marks, was asking you to identify and describe one World Health Organization strategic priority reflected in the information above. So note there that it says identify and describe. So for identify, that essentially means list. So I'd just be starting with listing one of those WHO priorities. So remember there's 3 of those. So addressing health emergencies, promoting healthier populations, and achieving universal health coverage. And so any of those 3 would be relevant, to this stimulus material here. And then you had to provide a short description and then link it to the information. You can see here in the examiner's report, only 9% of students were able to achieve full marks, and it mentions here the question was not handled particularly well. It said that students could typically identify a strategic priority, but most didn't include a description. And then a lot tried to simply restate part of the stimulus material without actually showing an understanding of how it reflected the priority. They've given an example here of addressing health emergencies, one of those WHO priorities, and the description they provided is that WHO works towards promoting health for all, with governments providing access to life-saving health services during epidemics and other emergencies, including health promotion. So make sure you do have a short description of all of those WHO priorities, and that's obviously one that you could take here for addressing health emergencies. They then went on to say the WHO supports member countries to build processes in preparation for health emergencies, and they require access to medications such as antibiotics, which is obviously a link then to the stimulus material, and that these drugs will be more effective if reducing antibiotic resistance is achieved. So once again, a link to the stimulus material. B then was asking for 2 marks to identify one example of the work of the WHO and outline how this example contributes to good health and well-being. So this didn't have to be linked to the case study. It was just simply an example of the work of the WHO. There's quite a few different examples of those, and then obviously a link to a dimension of health and well-being. So whenever you see health and well-being in a question, that's a dimension. So some of the examples of the work of the WHO are things along the lines of creating partnerships and demonstrating leadership, conducting research and development and disseminating this information, monitoring health and well-being trends and collecting data. So there's quite a lot of different examples you could have used, and then obviously you'd have to go on and make a link to a dimension of health and well-being. So you can see here, go back again. You can see here that if you'd given an example that perhaps was linked to carrying out funding and research, that you could have then linked that into, developing things like vaccine, and then you could link that on to obviously promoting physical health and well-being if new vaccines are developed, which means that there's a reduction in the spread of disease. So making sure that for those examples of the work of the WHO that you can think about what they actually mean in practice and how you can link that to things such as health and well-being. Hopefully you found that video useful. You can see here the Health Resources Hub YouTube channel that I mentioned earlier, the ACE HHD exam preparation sessions, our social media links, and our email. Thanks so much.